Nandita Mohan and I welcome you to Medical Dialogue's daily dose of health and medical news. Let's look into the latest developments in medicine. Blood pressure rise at night may double the risk of death in adults with diabetes. Higher the insulin resistance, greater is the risk of stroke, a study suggests. Early exposure to antibiotics tied with juvenile idiopathic arthritis. Study reports cardiac magnetic resonance is highly accurate for detecting cardiac tumors. A mind diet helps preserve cognition even in the presence of Alzheimer's pathology. Blood pressure and diabetes have been mentioned together in various circumstances. Yet again, a recent research presented at the American Heart Association's Hypertension Scientific Sessions 2021 has highlighted that adults with type 1 or type 2 diabetes whose blood pressure increases at night have more than double the risk of dying. Blood pressure normally declines or dips during the sleep. If blood pressure does not adequately decrease during the night, it is called non-dipping. If it increases at night relative to daytime levels, the phenomena is referred to as reverse dipping. These abnormal blood pressure patterns are associated with increased risk of cardiovascular complications and death in adults with type 1 or type 2 diabetes. The 21-year-old study included 349 adults with diabetes. Half of the participants were women and 284 had type 2 diabetes while 65 had type 1 diabetes. The authors reported that 82% had hypertension and 73% of the total had uncontrolled hypertension despite taking the pressure-lowering drugs. They also found that 1 in 10 people with type 1 or type 2 diabetes could be a reverse dipper and that this condition likely doubles the risk of death. Hence, it is important that healthcare professionals look for abnormal blood pressure dipping patterns in people with type 1 or type 2 diabetes. Insulin resistance, a concept when the body's cells do not respond to insulin and can't easily take up glucose from the blood. It is a key feature of type 2 diabetes and levels vary from patient to patient. A research recently published in Diabetology journal has found an association between insulin resistance and stroke among people with type 2 diabetes. Health records of more than 1 lakh patients were studied. The participants had an average age of 63 and 44.5% were female. The analysis revealed that higher the person's insulin resistance, greater is the chance of having a stroke. Those with lowest insulin resistance were 40% less likely to have a stroke than those with highest insulin resistance. It also mentioned that lowest resistance were 28% less likely to die during the follow-up period than those with more severe insulin resistance. In this era of personalized medicine, better stratification of type 2 diabetes patients will help optimize clinical trials and further vital research into treatment, diagnosis, care and prevention. The etiology of juvenile idiopathic arthritis is poorly understood. It has been shown that the use of antibiotics is associated with juvenile idiopathic arthritis. However, whether the association is due to an increased occurrence of infection in these individuals is still unknown. However, there is an association that has been found between early exposure to antibiotics and later onset of juvenile idiopathic arthritis, according to the study published in Pediatric Rheumatology. A population-based prospective birth cohort of 17,000 children where the data was collected on infections and antibiotic exposure during pregnancy and childhood. 102 individuals with the condition were identified. The results during the period of 1 to 12 months, 1 to 3 years and 5 to 8 years was significantly associated with an increased risk of juvenile idiopathic arthritis. The odds of developing JIA were higher, 78%, in those exposed to antibiotics during the first 8 years of life compared to those who were not exposed. The conclusion said that exposure to antibiotics early in life is associated with later onset of the disease. Cardiovascular magnetic resonance imaging, popularly known as CMR imaging, is a key diagnostic tool for the evaluation of patients with suspected cardiac tumors. The patient management protocol is routinely guided by CMR diagnosis, including no further testing. However, there are no outcomes validating this approach. Until recently, a study published in the European Heart Journal said that CMR diagnosis is a powerful tool to predict mortality incremental to clinical risk factors. The study included patients undergoing diagnosis for suspected cardiac tumors. The study showed that those compared with the final diagnosis, the CMR diagnosis was accurate in 98.4%. The conclusion said that CMR diagnosis provided incremental prognostic value, including left ventricular ejection fraction, coronary artery disease, and history of extracardiac malignancy. Have you all heard about the MIND diet? If not, let me just brief you a little about it. The MIND diet is a hybrid of the Mediterranean diet and the DASH diet. DASH being the mnemonic for dietary approaches to stop hypertension. The MIND diet includes green leafy vegetables, fish, nuts, berries, beans, and whole grains, and limits the consumption of fried and fast foods, sweets, and pastries. Why is all this coming into limelight these days? The reason is that recently it has been observed that adherence to the MIND diet can improve memory and thinking skills of older adults, even in the presence of Alzheimer's disease pathology. The study published in the Journal of Alzheimer's Disease said that MIND diet was associated with better cognitive functions, suggesting that diet may contribute to cognitive resilience. The study further indicates that it is never too late for dementia prevention. It focused on 569 older adults who were without known dementia. The series of analysis to examine associations of the MIND diet, dementia-related brain pathologies, and global cognition near the time of death were used. It showed that higher the MIND diet score was, it was better associated with global cognitive functioning around the time of death. The authors stressed on the fact that diet changes can impact cognitive functioning and risk of dementia for better or worse. There are fairly simple diet and lifestyle changes a person could make that may help to slow the cognitive decline with aging and contribute well to brain health. That's all for today. See you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.